Hi, my name is Jamie Corsa. I am from Wilson State College, and today I'm going to perform a postpartum assessment. So first I'm going to knock on my patient's door. I'm entering. Hello Shirley, how are you today? Good, my name is Jamie. I'm going to be your nurse, and I'm going to go ahead and just take a look at your wristband here. I want to make sure I have the right patient. Name, date of birth, and allergies. Okay. Good. Okay, Shirley, so today I'm going to go ahead and perform an assessment from your head to your toes. Is it alright if I ask your family to step out? Okay, so family has stepped out. I have shut the door and drawn the curtains for my patient's privacy. Okay, Shirley, so are you experiencing any pain? Okay, you are. And on a scale of 1 to 10, what would you rate that pain? A 4. And where would you say that pain is? Your stomach. So you're getting some uterine pain? Okay, and did they provide you any ibuprofen for that pain? They did about 4 hours ago. Okay, well I can go ahead and check and make sure that it's probably time to give you some more. Are you having any visual changes? Any blurry vision, ring around the lights, anything out of the ordinary? No, okay. Okay, and in your chart it says you're breastfeeding. How's breastfeeding going? A little difficult? Yeah, I can understand that. You're a first-time mom, so it's a little new to you. Okay. So I'm going to go ahead here and take a look at your breast and just make sure, see if latching is going okay. Okay, and I'm seeing some cracking and some blistering. And over here, about the same. Okay, and Shirley, do you have a sports bra at home or for someone to bring it to you? I do recommend those. It does help with support between the first, 1 to 3 days with that. As well as for the cracking and the blistering, we're going to go ahead and give you some lanolin, and that's going to help kind of soothe your nipples while feeding. It'll be a cream, so you'll just take a pea-size amount and rub it together and then rub it on your nipples. It is safe to have baby on the breast while that's on there, so you don't have to wash it off. And if you'll just go ahead and hit your call light when you're ready to breastfeed again, so I or another nurse can come in and just make sure that the baby's latching okay. Okay, so now I'm going to go ahead and lay it down and go for a ride here. Okay, are you eating okay? You are, okay. Are you passing gas all right? Good. And any bowel movements? No, okay, well that is pretty normal. And I see that they discontinued your catheter. Are you voiding okay? No pain with that? Okay. So I'm going to go ahead and just roll this up here. And I'm going to go ahead and just check your incision. I don't see any redness, edema, ecchymosis, discharge, and everything looks approximate. So when you do go home for that incision, we do want you to wash it, but we want to make sure you're cleaning and drying it. If you do notice any pain, redness, swelling, any warmth to that area, do call your provider because we want to make sure that it's not infected. And then I'm just going to go ahead now and check your pad. And I am noting some moderate amount of lochia. When was the last time you checked your pad? About 6 hours ago? Okay, so we'll go ahead and get you changed in a new one here in a minute. But first I'm going to go ahead and just rub your massage your fundus. So I'm going to go ahead and place my hand right above the pubic symphysis and right at the umbilicus. And I'm going to go ahead and just massage. I'm noting that it is firming, your uterus is firming, as well as it is 1 inch below the umbilicus. And while I'm doing that, I just want to look and make sure that there is, how much blood there is coming out, as well as clots. And there's only a little blood coming out, so that's okay. And then I just want to make sure, we'll get this pad changed here. I just want to make sure that you do know, when you do go home, if you go through 2 pads in 2 hours or have a clot the size of an egg or larger, we do need you to call your health care provider immediately, okay? So now I am going to go ahead and change my gloves. this is switching over to a patient who delivered vaginally. So Shirley, I'm just gonna go ahead and flip you over. Okay, so I'm just gonna go ahead and spread the buttocks. I do wanna make sure that there is no constant dripping of blood. And around a tear here, and then also there is a little bit of edema, which I will get an ice pack for you to help with that, as well as some hemorrhoids I'm seeing. And Shirley, are those hemorrhoids new or have they been there? They have been there? Okay. Any new pain with those hemorrhoids? No? Okay. Good. So we are going to see again about those pain meds. And as well as the doctor did order a stool softener to help with that first bowel movement, which will really help, and it won't have those hemorrhoids flare up so much. As well as we're going to increase your water and fiber intake to also help with that, okay? So now I'm gonna go ahead and just move down to your legs here. All right, how do they feel? A little swollen? Yeah, they do look a little swollen here. So I'm just checking, I'm noting that 2 pitting edema in the lower leg here, as well as 1 pitting edema in the ankle. And I'm gonna go ahead and just check your pedal pulses. And they're strong, equal, bilaterally. Good, okay. Okay, Shirley, and overall, how are you feeling? Yeah, how's the transition to motherhood? Is it going okay? Is it difficult? It's going good? Okay. Well, it is normal to have those baby blues, which is a little bit of a mild sadness for the first, 5 days after having the baby. If it does continue, if you do continue to feel that way, go ahead and get a hold of your healthcare provider, and so you can see him. If you do have thoughts of harming yourself or the baby, please call 911. As well as I took a look at your blood test. You are A positive and baby is B positive, so you do not need any RhoGAM injections or any additional injections. I'm going to go ahead and go check on that stool softener and that ibuprofen for you. Is there anything else I can get you before I leave? No? Okay, perfect. Thank you.